Hey there, and welcome to The Explainer. Today, we're going to talk about something that is, frankly, absolutely critical if you've had bariatric surgery or if you're on a GLP-1 medication, and that's vitamin B12.
So let me ask you something. Are you feeling just drained, sluggish? Maybe your focus is just gone since your surgery or starting your medication? Well, I'm here to tell you, you are so not alone. This is super common. And today we are going to get right into why it's happening and, more importantly, what you can do about it.
All right, first things first, we're going to talk about what a lot of people call the post-surgery fog. It's really important to know what these symptoms look like because they're basically your body's alarm system, right? It's sending you a signal that something needs your attention and you need to listen.
So what are we talking about here? Well, it's that kind of deep, persistent fatigue. You know the one, where no amount of coffee even makes a dent. Or that brain fog that just makes it impossible to focus. It can even get physical, like a weird numbness or tingling in your hands and feet. Maybe you're feeling weak, a little dizzy, or even just irritable. If any of that is ringing a bell, then yeah, you are definitely in the right place.
Okay, so we've nailed down the what. Now let's get into the why. Why is this happening? Because honestly, understanding your body's new rulebook is the absolute key to getting your energy and your focus back on track. And this is the part that you really have to let sink in. Your anatomy, it has permanently changed. I want to repeat that. This is not a temporary thing that's just going to heal over time. No, this is a fundamental, lifelong shift in how your body works, especially when it comes to processing crucial nutrients.
So let me break down how this change actually works. In a normal digestive system, your stomach acid does the first job. It yanks the B12 off the food you eat. Then, this special protein, it's called intrinsic factor, it grabs the B12 and carries it to where it can be absorbed. Simple enough, right? But after surgery, everything's different. Your stomach acid is way down. And that intrinsic factor, it's barely being produced, if at all. The bottom line, the B12 from your food, it's stuck. It just can't get into your system anymore.
And that protein we just talked about, intrinsic factor, it is the absolute heart of this whole issue. Seriously. Without it, your body's natural highway for getting B12 from food is, well, it's permanently closed. This is exactly why you can't just eat more steak or more eggs and fix this. That route is just not open for business anymore. Okay, this brings us to the really serious stuff, the high stakes. Because we're not just talking about feeling a little tired here. A long-term B12 deficiency, it puts your health at major risk. First up, we're talking about debilitating fatigue. And look, I don't mean just, I had a long day, tired. I mean a bone-deep, profound lack of energy that gets in the way of everything. Your job, your time with family, and just enjoying this amazing new life you've worked so incredibly hard for. And then there's cognitive decline. You know that brain fog we mentioned? The memory lapses, the trouble focusing? That's what this is. And over time, a serious B12 deficiency can really do a number on your mental sharpness and your clarity. And this is the one we all need to take the most seriously. Irreversible nerve damage. You see, vitamin B12 is absolutely vital for keeping the protective coating around your nerves healthy. Think of it like the insulation on an electrical wire. Without enough B12, that coating wears away, and the damage that causes, it can be permanent. There's no going back from that. But, and this is a big but, there is some really good news here. There is a straightforward way to prevent all of this. I absolutely love how our source material frames this. It says, daily supplementation is your insurance policy. And that's exactly what it is. A small, simple daily action that acts as an insurance policy against all those huge risks we just talked about. So, if supplementation is our insurance policy, how do we make sure we're getting the right one? Let's dive into finding the right fuel for your body. Because, and this is so important, not all B12 supplements are created equal, especially not for a body with a redesigned digestive system. Here's a great way to think about it. You wouldn't put regular low-grade gas in a high-performance sports car, would you? Of course not. Your body has been redesigned. It's a premium engine now, and it needs a very specific kind of fuel, a specific kind of B12 that can get around that broken absorption pathway we talked about. So that premium fuel really comes down to the form of the B12. You'll generally see two main types out there. First, there's cyanocobalamin. That's a synthetic form, and your body actually has to work to convert it before it can use it. Then you have methylcobalamin. This is the natural bioactive form. It's ready to go. Your body can use it immediately. Now, for anyone with a less efficient digestive system, that difference isn't just small, it's absolutely critical.
And this is exactly why you'll see supplements specifically designed for bariatric patients. You might see some, for example, that are high-potency chewables, or ones that dissolve right in your mouth. The whole point of this design is to use that ready-to-go methylcobalamin and let it absorb directly into the bloodstream in your mouth, completely bypassing the stomach and that whole broken digestive process.
At the end of the day, the goal here is pretty simple, isn't it? It's about finding the right key to unlock that B12 so you can get your energy back, sharpen your focus, and just feel your absolute best, so you can really thrive on this new health journey.
So how do we wrap our heads around this for the long haul? Well, it's all about a change in mindset. We need to stop thinking of this as a chore. Instead, see it as a lifelong act of self-care. It's about protecting the incredible, life-changing investment you've made in yourself. So let's just ask the question directly. Is B12 supplementation a lifelong thing? The answer is a simple, direct, and totally non-negotiable yes. Absolutely. Because your anatomy has permanently changed, your commitment to giving it what it needs has to be permanent too.
And instead of letting that feel like a burden, I love the way our sources put it. They say to embrace the routine is one of the most powerful and simple acts of self-care you can perform. And isn't that a great way to look at it? It's just a small, simple thing you do every day that protects your energy, your mind, and your entire future.
Look, you made a courageous, powerful choice to take back your health and your life. So the final question isn't really if you should be doing this. The real question is, how are you going to protect that incredible investment every single day? Thanks so much for joining me on The Explainer.